Do you have ongoing hip pain that feels like it's plagued you your entire life and you don't know what to do about it? What if the real issue was that this is something you were born with and nobody ever caught it? Today we're going to discuss hip dysplasia, which affects so many women literally since birth because you were literally born that way, but many of them do not know, and they go through years of trying to find an answer or just struggling through it on their own because the medical system has just disregarded their hip pain and they've never gotten a proper diagnosis. Or you may have gotten a diagnosis such as hip strain, psoas tightness, or even a labral tear. And this is super important because the hip dysplasia needs to be dealt with as soon as possible in order to keep you from getting arthritis as you age. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life and you deserve both. Today we're going to be talking about hip dysplasia, defining what it is, explaining how it affects you, and how to know if you might be suffering with hip dysplasia. First off, let's discuss the anatomy. So there's two bones that are involved in the hip joint. This is your femur, we're pretending, and this is your pelvis. So these bones come together to form your hip joint. Now, the pelvis may not be fully covering the femoral head as much as it should. And that's what hip dysplasia is when there's not a full covering that's supposed to be there in order to help maintain that contact. It's called a shallow socket because it doesn't have that full covering that it's supposed to. It's more shallow. Why this is a problem is because it leads to instability and poor loading through the hip joint. And since you're born with it, this starts when you're very young. It's very common in women and often goes undetected because when we're young, we can get away with a lot more stuff than we can when we're aging. So often women don't get diagnosed until they're in their 30s or 40s or even 50s. However, it's been something that you've been suffering with your entire life. So what does it feel like? Often people report a groin pain or deep hip pain. It may be accompanied by a clicking or snapping sensation. They'll have difficulty with certain positions and activities, such as lunges or squats or even certain yoga positions. Often people will have pain when they're trying to sit cross-legged, or if they're trying to stretch their hip flexors. So the hip flexors are the muscles on the front of your hip, and they'll feel like they're tight and they'll try to stretch them, but they can't stretch them properly because there's so much pain. And often this will happen when they're young. So many of them will become W-sitters, or that's what we call children who sit with their feet outside of their knees as opposed to cross-legged. And for some people, one side of their hip will feel like it's actually higher or tighter than the other side. And when I ask them how long this has been going on, they're like, I don't know, like I've always been this way. So why is hip dysplasia a problem? Well, if you have poor coverage, you're gonna be more unstable, which is going to lead to more motion, too much motion, which leads to wear and tear on the joint and can even cause labral tears. So let's discuss the labrum. So we have that hip bone, right? We have that femoral head that's contacting it. Well, there's a ring around the hip bone, and that's called the labrum, and that helps to extend that covering. Now, everybody has a labrum, and when you don't have hip dysplasia, it does a good job of actually covering that femoral head. However, if you have that shallow socket, even that labrum is not going to extend and cover that femoral head, which means it can get in the way or get pinched or even get torn. Which is often how people get diagnosed, is that they get diagnosed with a labral tear that was found on MRI, and then they notice that they also have the hip dysplasia. But it can also lead to other problems such as hip impingement or even early onset of arthritis, which the early arthritis may be compounded by the fact that all the muscles around the hip are trying to help stabilize that joint even more. And when they try to stabilize, they actually get tight, which doesn't really help, but they're dumb muscles. What else are they supposed to do? So the muscles overcompensate, which causes compression in the joint, which may cause the joint to form arthritis earlier than expected. So what are signs that you might have hip dysplasia? If you were diagnosed with a hip labral tear at an early age, this may be affecting you. If you have ongoing hip pain despite trying to stretch your hip or strengthen it. If your pain worsens with a deep squat or while you're trying to rotate your hip. And if you have a family history of hip issues or everybody in my family has a hip problem, chances are good that you may be suffering with hip dysplasia. All right, so if this all sounds like you're probably wondering now, well, what can I do about it? If I was born with this structural malalignment issue, what are my options? Well, luckily there are a lot of options for conservative management to keep this situation from causing you problems in the future. So what you are going to want to do is you're going to want to strengthen those deep hip rotators to help stabilize that hip joint even more, as well as your glutes. Those are the muscles on the back of your hip. That will help to take some strain off of the hip. And it's critically important that you work on your pelvic floor. You see, your pelvic floor attaches into those deep hip internal and external rotators. So by working on your pelvic floor, you can also be working on your hip. It's important to avoid aggressive hip stretching. So many women I see in the clinic who are struggling with hip dysplasia are very, very flexible and they are trying to stretch it out. Usually these are your gymnasts and your dancers and your yoga practitioners. But the more they stretch, the worse their hip pain gets. So you need to be focusing on getting those muscles around the hip nice and strong to help protect the hip joint instead of trying to stretch it out all the time. It is really important to work on your posture. We want to make sure that our spine is in proper alignment and we have equal weight going through both sides of our pelvis. If you're standing, you want to make sure you have equal weight through both feet so you're not putting too much pressure on one side or the other of your hip. And this is really hard for mamas who have babies that they want to hold on their hip on one side, and you get into this pattern of doing it. And if you have lots of babies, you get in the pattern of doing it for years and years, which is why I think a lot of women get diagnosed with hip dysplasia when they're in their late 20s, 30s, is because they've had children, their pelvic floor has changed, they've been carrying the babies around on one shoulder, and that's when all of these symptoms really start to show up. It is really important to change your movement patterns. You want to learn how to move better, not necessarily more. For people with hip dysplasia, again, they tend to be very, very flexible. We actually want to be more protective of how much motion you use on a regular basis, because movement is life, but excessive movement can cause problems. So when should you get imaging and what should you get? Hip dysplasia shows up most easily on X-ray, where they're actually able to do some measurements to understand the depth of the pelvis. And a lot of people who do have an X-ray, even if they are conservatively managing their symptoms, may have surgery recommended because they do have that hip dysplasia. So when is surgery actually indicated? Well, if you have a labral tear that is so bad and it will not respond to conservative treatment, you may need to get hip surgery in order to restore the normal biomechanics of the hip. You always do want to try conservative management first because there can be other secondary issues after surgery. But if your hip is inherently unstable and you have tried strengthening it and doing all of the things you can, it may require surgery to help improve your quality of life. It's important to know that you can live with hip dysplasia if you move wisely. As I mentioned earlier, people are born with this, but often don't get diagnosed until later on in life, which means chances are good that you have been managing this conservatively for quite some time. And with hip dysplasia, the goal is not to stretch more, it is to move better. Now, for you, that may require working with a specialist who can help you understand what movements are safe for you, as well as modify movements that you may want to do, but you need to do them in a special way for your body. Because working with a specialist who understands the biomechanics of the hip, but also specifically the biomechanics of hip dysplasia, is going to be crucial for your long-term management. If you're in the Maple Valley, Washington area and want to know if hip dysplasia is behind your hip pain, feel free to check out the link below to book a free discovery visit. And if you're suffering with hip dysplasia and looking for the best stretches and exercises that I do every day for my hip, then I'm going to have you check out this video right over here.